The Islamic Development Bank and the National Malaria Control Program present an innovative partnership on the road to the elimination of malaria in Senegal. Similarly to the international community, Senegal is strongly committed to the elimination of malaria by 2030. Today, our nation is cited as an example because of its daily fight against malaria for more than 15 years to control this deadly disease that has cost so many lives and resulted in so much suffering. The National Malaria Control Program, in charge of this response, with the support of its partners, has obtained over the past years particularly significant and promising results. The highest authorities of the country are strongly committed in this fight for a Senegal where no person will die from malaria. Winning the fight against malaria is a national priority. The mobilization of all stakeholders and the unwavering commitment to the strategy deployed and coordinated by the National Malaria Control Program has resulted in significant progress. This mobilization for the populations consisted of various complementary interventions for a positive and quantifiable impact. It resulted in a real and beneficial impact on the quality of life of the populations and the sustainable development of our nation. But progressing does not mean succeeding. Even though the response is being implemented at a faster pace and victory is close, malaria remains an endemic disease and a crucial public health problem. Senegal is today at a crossroads, a decisive moment in the fight against malaria, and has adopted the ambitious but manageable goal of the pre-elimination of malaria by 2020. In the context of the National Strategic Plan for 2016-2020, the National Malaria Prevention Program, PNLP, outlines the essential and necessary strategies and interventions. Dr. Doudou Sene, National Coordinator of the Malaria Control Program, explains. The National Strategic Plan is based on the Global Malaria Control Strategy as defined by the World Health Organization. We benefit from the support of many partners, including the Islamic Development Bank. The main issue is the need for an increased mobilization of resources. As we get closer to elimination, additional resources are increasingly needed to reach this objective because for each case we will need to conduct extensive investigations to avoid the spread of the disease across the rest of the community. The historic partnership was reinforced by the signature of a new agreement on January 23, 2017, between the Islamic Development Bank, long-standing partner of Senegal, and the state, with an original and innovative financing mechanism that included an important 3-year grant accompanied by a significant loan with no interest. This is in time for the PNLP to reach the crucial and unavoidable step of the pre-elimination of malaria and to achieve the specific goal of its elimination by 2030. The resources mobilized through the ISDB plan will be exclusively used to support the strategic composition that the PNLP acquired in the north and in parts of the center of the country, zones where pre-elimination is in a stabilization phase. Defending this position is an absolute priority. On the road to elimination, the planned interventions will have a sustainable impact on approximately 4 million citizens in 6 regions, and more specifically in 25 health districts, from Bour to Fatick, from Kébémer to Louga, from St. Louis to Richard Toll. The district of Richard Toll is a real reference district for malaria control in terms of results and attitudes of the population. It is a highly symbolic site in the fight against malaria and is an example to emulate in the region and beyond. It is a model to systematically adopt at the national level. Dr. Koumban Dauphin Ndiou, health doctor at Richard Toll Health District, explains, this model can be replicated in other districts, but you need a strong engagement of the community. We are used to saying that the technicians treat malaria, but it is the communities that lead the fight. So a strong community engagement is necessary to replicate this model. The PNLP has always adopted a participatory and consensual approach which integrates all the levels of the health pyramid from the ministry to the health post in the definition of these strategies. With time, this winning strategy has become an inclusive approach within which the community plays an increasingly important role. Kadi Ballo, health extension worker in the health district of Richard Toll, explains, "We are the link between the health facility and the population. Our role is to sensitize them well to better control malaria. We do home visits. We discuss with all members of the community in order to eliminate this threat." The final victory against malaria is everyone's responsibility and depends on everyone's engagement. Maintaining the necessary favorable conditions for the pre-elimination of malaria is an essential issue in which civil society organizations represent and will represent a key powerful determinant. Mobilizing and training local communities, involving them in the active process of prevention and investigation all the way to the most remote villages to reach the most isolated citizens and provide them with the necessary means for a rapid and effective response. This task requires important investments that we will be able to take on in a rigorous and effective manner thanks to the precious resources provided to us by the Islamic Development Bank. This partnership filled with humanity and solidarity, the Islamic Development Bank, Senegal, and the National Malaria Control Program are all rallied around the same fundamental values: the right to dignity for all and the right to health for each person.